Samantha Saywood, and also the Society for Occupational Medicine. We have Nick Parl, and we also have Professor Anne Harris, who is president. This is the third in the series that we've undertaken in partnership, and our first one series was around returning to work. We had so much of a response to that, we reran it a second time. And by popular request, we've decided that this important issue around managing mental health in the workplace was so crucial that we needed to address this again. So we will be looking today at a whole series of information from what are quite renowned and internationally renowned experts in the field. It's important to note that we have over 500 people registered through the day, and they come from all parts of both within Wales, outside of Wales, Ireland, Scotland, the rest of the UK, but also internationally and globally. We have small and large companies registered. We have public and private industries registered. And we have, for instance, people, organizations such as trusts, public services, universities. We even have DWP and CQC. We have the manufacturing industries, service, transport, police, fire, military, MOD, you name it, we've got them here. I think what's important to note is that because we have such an incredible turnout, the key issue remains that managing mental health in the workplace, in light of our current challenges around COVID, remains a huge challenge. So whether you're in Jersey, India, Indonesia, Canada, Singapore, the US, Colombia, Cyprus, we've got a whole range of people who share a common interest. And I'm sure that today we can help set up some of the key issues, help provide some of the tools, and help ensure that together we can find some of the solutions around which we can help address some of the challenges. I'm going to hand over to Anne Harris, who will set out a bit of the agenda and also outline how the session will work. Thank you.
Thank you. Next slide, please. Begin to feel like a politician here. Well, the effects of COVID-19 on mental health really cannot be underestimated. For most of the period from the end of March to the beginning of June, most of us have been confined to our homes, and we hear regular messages of the dangers of mixing with others, and this percolates into the inner depths of our minds. Some people have continued working as key workers, whether they be in shops, because we couldn't exist without food that they have for us to buy, public transport, and within the health service. But the media consistently talk of those working in the NHS as being on the front line, prepared to make the ultimate sacrifice. And I've got a real issue with that. We shouldn't be going to work expecting not to come home, or to go home severely injured because of the effects of COVID. The effects of COVID-19 doesn't just affect the physical health of those who contract it, but there are significant issues impacting on mental health, and these are often much more difficult to either talk about or to detect. Next slide, please. So this webinar, which is presented in association with the Bevan Commission, brings together a panel of international experts in mental health, and we're going to explore the impact of COVID-19 on mental health and relating this specifically to the workplace. Next slide, please. So what are we going to cover? The title of Sir Mansell Aylward's session has been changed slightly. The panel today will explore happiness in work. He's going to be talking about evidence, key risks to people's mental health, and that's going to be delivered by Emma Mamo, Head of Workplace Wellbeing at Mind. Theoretical perspective, explored by Neil Greenberg, who's Professor of Defence Mental Health at King's College London. Roxane Gervais, who's an organisational psychologist, will be looking at evidence-based practice, and I'll be picking up questions and answers, and then finally handing over back to Sir Mansell Aylward to close down the meeting. And Sir Mansell is the chair of the Bevan Commission. This is really demonstrating the importance of Bevan with all these people from all over the UK and the world. Just a quick plug of some tools that SOM have produced. The SOM Mental Health Toolkit was developed by the panel members in association with Mind, and it's available from that website. And not only that, it's got a stamp of approval by the Royal College of Psychiatrists. So now Sir Mansell Aylward will give the first presentation, Happiness, Resilience and Wellbeing in Disadvantaged Communities. Thank you. Over to you then, Mansell. Mansell, I think you need to unmute your microphone. So the bottom left, just take off the line and it should go green.
Am I audible now?
Perfect.
Yes. Excellent.
Absolutely
Excellent.
Perfect. Thank you.
Okay. Good morning, good afternoon, good evening, whatever the time is where you are. What a pleasure it is and honor to give this presentation to such a diverse, international and large group of people evidently interested in this most important, indeed critical topic of managing mental health in the workplace. You may wonder when you look at my slide why I've chosen this particular topic in a webinar which is focusing on mental health in the workplace. Well, as you all know, the importance of happiness, well-being and resilience at work and in our working lives are paramount in gaining satisfaction with one's work and leading a full life and on the whole a happy life related to that occupation. Also, what do we mean by health and well-being, subjective terms, and indeed resilience? How are they related? I hope I'll be able to demonstrate that in the next 20 minutes. What is health and well-being? Well, these are very subjective and very poor definitions. Usually health is operationalized as the absence of symptoms, illness, disease, and morbidity. But all of you know it goes well beyond that. Well-being, another subjective term to define, is somebody who is happy and contented. Again, subjective terms, comfortable and satisfied, having a quality or perceiving themselves to have a quality of life. And that includes those words underneath: physical, material, social, emotional development, and activity dimensions. They're difficult topics to address, difficult subjects to assess because of their subjectiveness, and indeed there are many different definitions that we could use. Next slide, please. When the World Health Organization first defined health in 1948, and believe it or not, that is still the definition by the WHO, it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Whilst I accept that, if you look at that definition, and those of you that are familiar with that definition, you'll say to yourself, the only sort of person that could be healthy is one with an immaculate conception, because all of these different points are bound to be affecting people at some time in their life. There isn't anyone I know with a state of complete physical, mental, and social well-being. In fact, if they did, I'd wonder about their mental health. The proposed definition that I'm going to adopt is one that was developed in Harvard University. I was part of the team, but certainly not the leader in any way. But the proposed definition was the ability to adapt and self-manage in the face of social, physical, and emotional challenges. And that has been accepted in some countries already. That means that you could have someone who we would describe as unhealthy in the first definition, but leads a very fulfilling life in that they've adapted to that. And they've done that in the face of social, physical, and emotional challenges. And you'll see as I go through this talk why I think that definition is more important than this one, which can only be accepted if you are a perfect person. Happiness is related to several aspects of well-being. Obviously, those that are listed down there, you will be very familiar with. And one big one is greater job satisfaction. That is profoundly related to happiness, or is it that happiness is profoundly related to having greater job satisfaction? But what has this got to do with health? Next slide, please. When ill, people are generally less happy. That's a truism, so I won't go into that any more. But it's the converse is also. Sorry. Sorry, I think.
Sorry,
I got interference.
To mute their computers, please. Could we please ask people to mute their microphones, please, to stop
whatever, yeah.
Okay, I can't. Somebody tell me if you can still hear me.
Whatever.
Yes.
Yes, Mansell, you can carry on.
Okay. Well, I've got to the point where I was talking about when ill, people are generally less happy. That's a truism. Won't go into that any further. Depression and anxiety, however, influences prognosis quite markedly in several physical illnesses. But does happiness influence current or future health? The answer is yes. Data is available. There are good studies, particularly in the last 10 years, showing that happiness is related to reduced mortality in healthy and in ill people. And that's a profound statement that has been demonstrated. It's independent of health status and demography and risk factors. And it persists. Happiness persists. Health and happiness can persist after you control for effective status. Next slide, please. And these are the important things which I think we need to address in this topic this afternoon. And that is the lack of clarity that there is. Happiness is beneficial over and above the absence of misery. Important point. There's growing evidence that happiness influences future ill health. Very important point. But as yet, there are still very few intervention studies that improving happiness has convincingly favorable effects on health. More data has been accumulated, and there seems to be that relationship, but not yet entirely clear. The positive effect or happiness changes unhealthy behaviors. We know that people who are happier and more satisfied in life are able to give up smoking, are able to have a better diet, are able to undertake physical activity, and they may be interrelated in any way. Next slide, please. Next slide, please.
Okay, leave it.
I'm now coming to an intriguing and novel hypothesis which I've been pursuing and relates to the topic of this afternoon, and that is these states, emotional states, can be transferred directly by mimicry and emotional contagion. One person's mood fleetingly determines the mood of others. This is very similar to the spread of obesity and smoking behavior, and the way in which obesity and smoking behavior can be controlled by the transference of those emotions between people. Thus, is happiness a network phenomenon? Can it spread from person to person? And do niches of happiness form within social networks? If they did, wouldn't that be very helpful at work? If there were a niche of happiness which was spreading and satisfying within the context of the workplace. The corollary is, could happiness and well-being indirectly contribute to social transmission of health? And I hope to acquaint you with data which suggests that that is definitely so. It's not just a weak, an interesting subject which you can't define. Next slide, please. There's been a large study, which I'm going to talk about now, which was undertaken in Massachusetts. The objective was to evaluate whether happiness can spread from one person to another and whether there are niches or clusters formed within social networks. It's a longitudinal study, and many of you will be familiar with the studies undertaken in Framingham, which is 25 miles actually from Boston, where the Boston Marathon usually starts. And people have been examined there for many, many years. In fact, it would be difficult if you went into Framingham to find anybody that wasn't already in a study by Harvard University. And the investigation is, because it's continuing, whether happiness in a key person is affected by happiness of other people who are socially connected to the key person. Many people in this audience now will say, well, of course they are. Isn't it self-evident? No, things are maybe self-evident, but you have to prove them by experiment and by having information and evidence that supports that. So this is something that we feel may be true, but let's see, is it true? And this is what this study does. The outcomes that were looked at, that were used to measure, was a validated happiness scales, and there are many of those, the attributes of social networks, and looking at diverse social ties between the various people in the group. Next slide, please. So key persons were selected at random, who were connected by social ties, whether they were family, friendship, spousal, neighbor, and co-worker, to other people in the community. Other people were those other than the key person, but having a relationship of some sort with that key person. We're looking at big figures, 12,067, many in the studied cohort. And the question was if and how the other person influences the key person you've selected at random in regard to any social transmission of resilience or happiness or well-being. And the contact followed up from 2 to 4 years. And the findings were remarkable. Next slide, please. There was complete information connected. I'm not going to go into all this sort of data because one can spend too much time on it, but I'd like you to look at the 3 friendship ties that were looked at. The key is the perceived friend, but the other does not reciprocate. So the key person thinks this person is their friend, the other person doesn't necessarily think so. The other perceives the key person as a friend, but is not reciprocated by key. And mutual friends, they both love each other, for want of a better expression. And the hypothesis was that the hierarchy of influence, if there was an influence, would be that the mutual friendship was greater than the key friendship and greater than the other. There was a hierarchy of influence across that depending upon the relationship that existed between the participants. Next slide, please. The results, as I've little time to go into this in great detail, but the results were remarkable, and as I will show you, are being confirmed by others. Happy people tend to be connected to one another. Again, people have said to me, well, we all know that if you go to the pub, you'll see people around some person. Somebody walks into a room and the room changes. People are more friendly and happy. Yes, that's so. We perceive that. That is something that we've come to accept over the years. But is it a fact? Does this happen? Or does it just occurs in flashes and it doesn't persist? Are there clusters of happy? There were clusters of happy people. Are they larger than expected by chance? So we can see an occasional cluster, as I've said, in a pub or in a gathering, but is this a real relationship? Is it large? And is it more than would be expected by chance? Is there an association between this key person that's been selected and the other's happiness significant up to 3 degrees of separation? Now that's a public health phrase, up to 3 degrees of separation. And the findings were that there was an association between key and other happiness and the other's happiness, which was significant up to 3 degrees or more of separation. Also, it discovered that connected people significantly influence happiness only if they live close to the ego, the key person. They use the word ego as the key person. And then the numbers of direct social ties and indirect ties influence future happiness. So in a nutshell, should go into this in more detail, there was demonstrable social transmission of happiness and well-being from one person to another, which went from house to house. And we'll explain a bit more. Next slide, please. The emotional state of social relationships were more important than the number of ties. So if it was the strength of the way in which people felt for each other, were related to each other, and the social magnitude of that was more important than just the number of ties that somebody had with somebody. Subjective thing itself, but very, very prominent and undoubtedly demonstrated in this study. However, the effect decays with time and geographical separation. But when the geographical separation changes back to the person living nearer again to the key person, then that social transmission was again fortified. This is a very interesting one. Socioeconomic status could not explain clustering of happy people. So you didn't have a bunch of people who were rich and wealthy, and that's why they were happy. You didn't have a bunch of people who were miserable because they had no work, no money, and they had a crippling disease. No, the socioeconomic status that was demonstrated, there was no such relationship. It's unrelated to local levels of income or education, fits in with the socioeconomic status, and the transfer of happiness was not just a function of individual choice or experience. In short, happiness is a property of groups of people, and it forms in clusters, whereby one person influences markedly and significantly the subjective states of another. Next slide, please. What's the relevance to public health is a very potent one. The cascade effects, one to another, on others could flow from policy decisions, clinical or behavioral interventions, which increase the happiness of one person. So by increasing the happiness of one person, you're actually increasing the happiness of many others. And of course, within that happiness, what are the factors that actually are transferred? It's not just a subjective feeling, other things are transferred. But it's so important that it does happen. There'd be enhanced efficacy and cost effectiveness if we were able to spread messages in that way and see results in improving people's happiness and resilience. There would be collateral health effects, and we are quite certain that it would reconfirm that happiness spreads broadly in social networks. Next slide, please. So I consider this a groundbreaking study. Because my research has largely been based on psychosocial determinants of health. And this is one study which showed that some psychosocial determinants of health could be transmitted through social connections. And of course, when you think of the workplace, that is a place where social connections are abundant and dominant. Major implication, therefore, for design of policies and interventions by understanding this and adopting this and having a way of spreading the subjective or objective parameter that you want spread. Reasonably robust results were provided by this study, which will generate new and productive research into happiness and well-being. And the second part of my talk will be about that, where we have actually undertaken in Cardiff and in Boston a further extension of this study. There were some methodological concerns, actually, in the study. The friendship selection was not random, obviously, people are friends or not. There's some environmental confounding, but they did, that was their study, show that there was no actual environmental issues that actually affected results that were being found. And there was this spatial correlation of socioeconomic factors. Next slide, please. Now come home. This is a study of resilience and well-being clusters in South Wales, in a South Wales community. We looked at resilience as well. Now, resilience can be defined in many different ways, but the simplest way of doing it is to say it's the ability to perform better than expected in adverse circumstances. And it can also mean bouncing back in adversity. These are simplistic ways of describing it, but the actual resilience parameters that we measured were by metric systems which had been fully validated. So we were looking at the person's individual resilience as well as their happiness and as well as their well-being also measured by interview and also by standard scales. Next slide, please. And what we did, there was a look at the population in the South Wales Valley, high morbidity and mortality, low income, unemployment, benefit dependency, high teenage pregnancy, and social housing. Now, in communities like that, if we could show there's a demonstrable passage of happiness from one community to another, which is associated in some ways with health, then that would be a stiff test of whether or not there can be social transmission of these emotional states. The design was exploratory and scoping, observational and qualitative. And the research questions were, are there clusters of resilient people in such a community as this? What is the observed relationship between the exhibition of resilience and the measures of well-being? Did they correlate? Not many people have done that in the past, and this in this way is a sort of groundbreaking study. Is there any evidence of spread of happiness, well-being, resilience, as demonstrated in the studies in Massachusetts? And then converse to the study that I've just described in America, does the happiness, well-being and resilience of the key person influence the happiness, well-being and resilience of others? So it's the other way around. We're looking at transmission the other way. Next slide. We had to identify presumed resilient persons, and this was done in a very empirical way, but was shown to be effective in that by identifying these people by these characteristics, we were shown that they scored high on resilience. The appearance of houses and gardens, well-run gardens, dustbins, left in the right place with the lid on, clean, tidy, cut grass, that suggested that there was a resilient person in there. Participation in known cultural, local and social activities, community forums, representational roles and perceived local profiles. And someone who helped me with this is a chap called Malcolm Gladwin, who has written The Tipping Point and a number of books, well-known books, and he helped me discover how we could measure and look at what the contents of the subjects in the house's emotional states and resilience were by appearance of the external environment in which they lived. What we did was we looked at adjacent persons, the others, within the perimeter of just 4 adjacent houses, because the study in Massachusetts had shown that the distance, as the distance increases, then that effect wanes. And then we had controls, whereby we randomly selected people who did not show any resilience in the perimeter of 12 adjacent houses, and excluded if a meeting presumed, if we selected a house which was already highly resilient, we didn't want that as a control.
Nancy, it's Nick here. I'm going to have to ask you to wrap up in the next couple of minutes. Thanks.
I thought I had 25 minutes. Sorry. Okay. Right, emergent findings. Here we are. Leave that. Let's go to the next slide. That's just showing the results. What we found was clusters of resilient people were found in the community. Resilience and well-being was associated, but resilience was present when parameters of well-being not fully met. Among key and adjacent persons, resilience and well-being was associated, had a greater prevalence than in the control group. Absence of resilience was sometimes associated with minimal levels of well-being, and resilience and well-being were greater in those at work. Anyone in work at a greater level of resilience and well-being. I will finish in that time. Next slide, please. The South Wales study findings compared with the Framingham one showed that emotional states of social relationships were more important than total number of ties. The level of engagement, for example, of mutual friends. Socioeconomic status did not explain clustering of happy people, as with the Framingham study. Unrelated to local levels of income, education, or social status. Happiness was not just a function of individual choice or experience. Happiness is a property of groups of people. And most importantly, and the work that has been done subsequently in the workplace showed that remunerative work had a positive relationship with happiness and well-being. That was not looked at in the Framingham study. in the work that we've done since looking at the workplace, the social transmission of happiness, of resilience, and of well-being, and of sickness absence rates are all related and are related to that social transmission of having one person in the beginning who may be the seed, and that is spread throughout the small community. Doesn't happen invariably, but there's a major effect which had not been looked at or discovered previously. Next slide. I'll finish with this one. In adjacent persons, the occurrence of resilience and the magnitude of well-being appears to be associated with strengths of mutual relationships with key and major other persons. 30% of adjacent persons had moved to live near key persons from elsewhere in the South-based study. I'm getting a lot of interference on my 30%. Let me just end by saying any work associated with was associated with pronounced resilience and well-being. I can have the last slide, please. I can't hear a thing because. Right, here they are. The findings are in keeping with the individual's happiness and well-being depends on the well-being and resilience of others with whom they are closely connected. This relates to connected in the workplace. As well as possible spreads of resilience and well-being, there may be an attraction effect. People actively moving to be perceived to the environments perceived to be those which they would like to spend and have a reason to value. People are embedded in social networks, and the resilience and well-being of one person affects the resilience and well-being of others. You may have to have time to think upon that, but it's a profound, a revolutionary finding in a way, not because we did the study, but if one person has a happy and joyful and resilient personality, they can spread that, not knowingly, but spread it to others, and others appreciate that. And that, I think, is something which should be looked at when we're looking at mental health problems in the workplace. Thank you very much.
Thank you very much, Mansell. That's a brilliant presentation and some wise words there from experience. There has been a question on the chat in terms of if someone with kind of mental health diagnosis or depression has more chance of getting COVID, which I imagine, Neil, you can respond to. My immediate reaction is no, because that's not related, but you know, I'd be interested to know panelists' comments on that. But I'll move straight on to Emma Mamo from Mind. And Mind have been a brilliant partner with us on Return to Work toolkits, and obviously have a big presence in Wales and across the country, leading kind of work with corporates in their leadership council. And Emma's leading some fantastic work in terms of just general mental health, and encourage you to look at the Mind website too for a huge amount of excellent resources. So I'm very happy to introduce Emma Mamo for the next slide deck. Thank you, Emma.
Thanks, Nick. Hello to everyone, and thanks to Mansell. Next slide, please. And people aren't aware, across England and Wales, Mind is a leading mental health charity, and our mission is simple. We're here to make sure that anyone experiencing a mental health problem gets both support and respect. So there's the support that we provide through our local Mind charities, so they are responding to the needs of their local community. But in terms of respect, that's the work we do at a national level, lobbying government, ensuring there's funding and services that are appropriate for people. And there's the work that I do with my team, where we're working directly with employers and other partners. So they are creating mentally healthy workplaces that keep their people well, that identify what might be causing their staff to struggle, and then can support staff who may be struggling across that whole spectrum of mental health. Next slide, please. Thank you. In terms of what we've been doing since the outbreak of COVID-19 is trying to really understand the impact that it's having on people's mental health, both people who have existing mental health problems, but then also how this might be leading to and causing people to experience mental health problems perhaps for the first time. I think we can all acknowledge that it cuts across all areas of well-being, our physical, our mental, and as Mansell's just been talking about, the real importance of our social well-being, but indeed, of course, also our financial well-being. In terms of the impact on individuals, I can fully recognise from myself the real roller coaster that I've been on during this time. I think it's all impacting us in very individual ways, but in multiple ways and at different times. So thinking about what we've all been going through, what our colleagues have been going through in the workplace, what our friends and family have been going through, and understanding how that is impacting on all of us in different ways. In terms of the impact on mental health, it is varied, and for a number of reasons. It's the health anxiety that goes hand in hand with a pandemic such as this. It's the uncertainty we're all facing, both in terms of us at an individual level, in terms of our livelihoods, our health, but equally right up to our organisations' survival, and indeed the economy, and how we're going to come out of this period of lockdown. And then it's the isolation that we've all been faced with during the social distancing and the restrictions that have been placed on our daily lives. And of course, it is the loss of life that many people have experienced within their family and friends. But for those working in NHS and social care, it's also people that you've been losing as colleagues, and indeed other key workers who have been leaving their homes, leaving a place of safety during this time, and putting themselves at risk and so on. And so indeed the trauma attached to that. So I think for us at Mind, we're very concerned about the impact this will have on the nation's mental health, and we feel it will have a deep and lasting scar on the nation's mental health because of lockdown, the loneliness we've all been feeling, and the recession that I'm sure is coming. Next slide, please. Thank you. So at the start of the outbreak, we launched a survey for both adults and then children and young people to really understand what it is like for people currently, how it's impacting on their mental health. So I'm just going to share some of the headlines, but we have now released the report that details this in terms of all the themes and insights we've discovered, and I'm sure we can share that in the chat window and so on. But what we found, 16,000 people responded, and what we found is around 60% of the adults who took part in the survey said their mental health had got worse during lockdown, and 68% of young people had said that it had got worse during that time. When we looked at what were the key drivers for people who were saying their mental health was poor or very poor at this time, we found that parents and people from BME communities were more affected by concerns about work that was impacting on their mental health. We found that women were disproportionately affected by the loneliness and the restrictions being placed on everybody's lives during this time. We also found that for around a third of people who had an existing mental health problem and would have been seeking support for their mental health from services and so on, felt at this time, because of the heavy burden being put on the NHS at the time, they felt their issues weren't serious enough to seek help. And obviously we have tried to communicate during this time that if people need help for their mental health, please do access services and seek that support. But people really didn't feel it, they should be doing it during this time when we felt our health service was under such immense strain. When we asked people about how they were coping during this time, many people were adopting, positive coping strategies in terms of connecting with family and friends, even if that had to be in a digital way. But we did find a lot of people were drinking more alcohol than usual. We found that people were either eating too much or too little to cope. And when you looked at 18 to 24-year-olds specifically, they were using negative coping strategies such as illegal drugs. And we also saw a rise in people self-harming during this time as a way to cope. So those are some broad headlines. Next slide, please. Thank you. Just to share a bit more detail in terms of the key factors that were affecting people's mental health during this time. Not seeing people you don't live with was top in terms of driving poor mental health, not being able to go outside. Then the next was around the anxiety of either friends and family getting the virus and feeling bored and restless. And this was a key driver for young people specifically. Then there was obviously the anxiety about getting the virus yourself and feeling lonely. And there were difficulties that people, the difficulties in terms of buying food and essentials during this time, and concerns about work. And I already shared that that was a particular concern for parents and people from BME communities. So those are the key factors that were affecting people's mental health during this time, and in a negative way. In terms of the next slide, on the 10th of May, we had the announcement of some of the restrictions and social distancing being lifted, and we saw a very stark change in terms of the respondents from week 4 to week 5. Around 42% of our new respondents during that 5th week of running the survey reported that their mental health was poor or very poor, in comparison to a third of the new respondents the prior week. So it's really shown us during this time, when government makes announcements around social distancing, this can drive a real sense of anxiety amongst people. We saw it in our respondents, we saw it in terms of people accessing our helplines and so on. We also found that people were feeling less optimistic about the future, and also feeling like they hadn't been able to relax during this time, and also saying that their mental health had got much worse during this time. So it shows the fear that people have around coming out of lockdown, and whether that's the right thing to do at this time, and what that means for them as individuals, and then family and friends. Next slide, please. Thank you. And at that point, we had included free text boxes for people to share any thoughts and feelings during the survey. And we didn't ask specifically around returning to work, but that week, in week 5, we found a lot of comments and responses in the free text box around returning to work. People saying, I work in a school, I don't feel like we can follow social distancing. Other people sharing a lot of concerns about their commute to work and how safe that would be. People feeling very concerned about being around others. So you can see from some of these quotes, again, people on furlough and then feeling worried about coming out of furlough and going back to work. And we know that transition points for people can be real triggers for poor mental health. So I think that's a key group to be concerned about in terms of people who've been furloughed. Next slide, please. Thank you. In terms of the impact on workplaces, alongside the survey we were running focused on individuals, my team was also running a survey of employers. So around 800 employers took part and shared with us their experiences during this time. And what we found is that most employers were unable to operate as they normally would, and over half were operating with fewer staff. When we asked them around some of the key concerns and issues they were grappling with, 2 in 5 employers were struggling around remote working issues and increased health and safety risks. Huge concerns about people now working from home, and how do you really help people to work in a safe way during this time. And we found that while a third of employers had seen decreased demand for their services and products during this time, we found that around a quarter had seen increases in demand. So you can imagine the challenges, and I'm sure you'll see it in the organisations you work within, just that huge challenge at that time to having to pivot and respond to a global pandemic with fewer staff, but also having increased concerns about your staff during this time. Next slide, please. Thank you. When we asked employers for what they, the things that were most concerning for them in terms of their staff, we found that there was real concerns about the perceived or actual negative impact on staff mental health and social well-being during this time. But then people were obviously concerned about staff in terms of their physical well-being, financial well-being, and then in terms of the organisation as a whole, just loss of income during this time. Next slide, please. Thank you. When we asked employers what they were doing in response to this, first and foremost, it was around putting in place well-being support measures, or indeed just promoting what they already had in place, or making changes to make sure they were accessible to staff in a digital format while working remotely. They're also taking a variety of actions to support with some of the challenges, so furloughing staff or redeploying staff as needed, taking advantage of government schemes that were in place in terms of financial support, seeking external guidance, and then reducing capital expenditure to manage the loss of income. Next slide, please. Thank you. So in terms of returning to the workplace, first and foremost, I think well-being needs to be the priority for staff and how you support your staff, but really understanding people's individual circumstances. We've all been in the same storm, but we haven't been in the same boat. And I think we need to really have good conversations at an individual level to support people to return to work. It's not a simple reversal, as Anne already said. We've been told during this whole time we have to stay at home, take care of ourselves, put our safety first. We now see that, you know, the accountability for your personal safety is shifting from government and the choices you make to the choices and things put in place by your employer, the choices your colleagues are making, people you might interact with on your commute. And the public are really polarized around easing out of lockdown. So it's really understanding that it's not the same as when we went into lockdown. The impact of isolation, I'm sure for many people have found it very difficult during this time to be isolated and would be keen to reconnect with colleagues. But for many others have gone through it, anti-socialization, if you will, and are very concerned about being around others and what that will mean for them. The fact that things are still not known in terms of the future, and we've already seen local lockdowns in the UK, and you know what will happen as we move into autumn and winter in terms of, you know, second waves and so on. On a positive note, for many years I've worked in this space, and we've spoken to employers about changing the way they work and how that can impact on people's mental health in a negative way. We've often been told, well, that's the way we do things, but this has been a massive disruption to how we all work and has opened up opportunities to work in different ways. And I think it's important to think through how we build back to a new normal, where we keep some of the things that have been beneficial during this time and the flexibility we've offered to staff and so on. So I think it's important to think about the opportunities this offers us. Next slide, please. Thank you. I will, this is my final slide, and I know other panelists are going to be covering this in more detail, but I suppose thinking about those two specific groups, people who've been working from home and challenges they might have been experiencing around their mental health, is around burnout and fatigue. There's been a lot of surveys showing that people are working 28 hours more over a month period, so doing all that overtime. People with care and responsibilities who've had to juggle being a parent while also doing their job have seen huge challenges during this time. The emotional impact of remote working, a feeling of disconnection from their workplace, decisions being made without you, and so on, and the loss of autonomy. So as I've said, people have been working in a way that has been, you know, without a commute, in times and hours and working patterns that has suited them. So thinking about people, bringing people back into the workplace and that loss of autonomy they might be facing. So what flexibility we can offer people. In terms of people who've been furloughed, you know, they've been in a holding pattern. Now coming out of that is what happens next. Organizational survival, what does that mean for my job? So being very clear about how you can support people during that time. Re-establishing a work routine, especially if they've been furloughed for a considerable amount of time. And again, thinking about the emotional impact of being furloughed. So if it was a case where all of the organisation was furloughed, that's one situation. If there was a case where it was some staff furloughed but not others, what impact that might have for people in terms of their perceived value to the organisation. If any things during this time have impacted on people's trust of the organisation, you know, reparation will be needed around that. And many organisations have been able to top up people's staff from the people's wages, from the 80% mark covered by the government scheme, but many organisations won't have been able to do that. So people would have been living with a reduction in their wages. So these are some of the key issues to be mindful of in terms of those two groups specifically. Next slide, but I think that is me finished. But yes, we've created a whole host of informations in partnership with Society of Occupational Medicine, but also other stuff. So there's a web address in case you want to have a look at what's available. Thank you.
Thanks very much, Emma. That's a great presentation, and it seems people appreciate it on chat. I quite like the comment on chat about some people working fast, some people slow, and it's difficult for the people working slow. And you know, I think we've got to be kind to each other. And you know, if you're working slow, you're working slow. It's not an easy time. Just one quick question. I don't know if Emma you can quickly respond. Is that survey? Did it survey kind of frontline workers, and what was the mix of the people on that? Did it include those people?
Yeah, it did include people who were frontline workers, so I can share some of the information through that, but it was cascaded to all people. But we have launched a campaign in partnership with Samaritan's Shout and Hospice UK, looking at the needs of frontline workers, and there is a helpline and a tech service. And again, that's giving us more data about what people are experiencing during this time, so I'm happy to share some of those insights.
That's great. I mean, it's concerning if you look at the sort of death rates by occupation that ONS produced, that some workers on the front line, sort of security guards, retail, care workers, you know, having higher death rates, it seems. There needs to be further work on that, though. Okay, I'm sadly going to have to move swiftly on, but thanks so much, Emma. It's brilliant work and well done, mine generally. I'm going to introduce Professor Neil Greenberg, who's Professor of Defence Mental Health at King's College London. Is a fantastic advocate for mental health in the workplace, particularly background in the military. I recommend you follow him on Twitter in terms of the new research and what is a fast-paced kind of research area where people are learning all the time. And Neil's going to talk about sustaining mental health as workers return to the workplace. Many thanks, Neil. Over to you.
Thank you very much indeed for asking me to speak and for the kind introduction. Next slide, please. So just very briefly, I've already been introduced. You've got my Twitter address there if you'd like to follow me. I served in the military for 23 years. And during the COVID crisis, I've been helping to support NHS England, their wellbeing team. And also during the early part of the crisis, I set up the mental health support strategy at the London Nightingale Hospital, which thankfully wasn't needed. And I've done some other work for Public Health England and Department of Health and Social Care. Okay, next slide, please. If you want any of the information other than following me by Twitter, there's all the websites here are all good evidence-based websites, and the information I'll talk about broadly is in those places and free to download too. Next slide, please. So in broad terms, during the actual crisis and certainly what's happening now, there's been kind of four main sort of groups of stressors. Obviously, there's traumatic exposure. Many key workers who have been working in highly challenging environments, not just healthcare workers, but also many other groups as well, emergency services and social care in particular. Workload has gone up. I think Emma's very kindly sort of mentioned that already, and people have been working lots of hours, and shifts have really changed. And of course, many of us have faced stresses at home, which have been particularly challenging. Again, mentioned already about sort of children and pay and the like. And then there's also this concept of what's called moral injury. Next slide, please. So moral injury is a situation in which the environment you find yourself in directly clashes with your moral or ethical code. Now, this is particularly important at this time because if you may have been, say, a social worker who normally would be able to sort of visit their higher risk clients, but actually during the crisis you haven't been able to, and then something bad happens, the question is, how does that make you feel? How does that make you think? And we know that moral injury can occur as a result of things that you do that you really wish you hadn't done, things you haven't done, and also what's called betrayal by a higher authority. So where you feel your employer has let you down. And of course, many of us have seen the debate that's gone on about sort of PPE, and I don't know what the right and the wrongs are, but you can see quite well why people would feel let down if they didn't have the right equipment to do their job. And moral injury is important because whilst it's not an illness, it is a situation which many people find themselves in, and it makes you vulnerable to become unwell. So we know people who suffer with moral injury may be at higher risk for depression or post-traumatic stress disorder, or sadly even suicidality. Next slide, please. This is a Centre for Mental Health report, which was done now a couple of months ago. And what this tried to sort of show overall, and this was a prediction, was that in the general population, whilst the risk of COVID begins to go down, the mental health needs that follow from COVID may well be continuing. Next slide, please. Where are the mental health risks? Well, probably the biggest one from an evidence-based viewpoint is going to be the economic impact. And we know that in 2008, with the recession then, there was an increase in the rates of depression and sadly also an increase in the rates of suicide. And the predictions are that maybe up to 500,000 more people will experience depression as a result of COVID. Remember, these are just predictions, they don't always come true. Clearly, some communities, such as people with a BAME background, people who are in poverty, are going to be more affected by what's going on. Sadly, we know there's been lots and lots of deaths, and many of those deaths have been far from pleasant, and this can lead to what's called complicated grief. And of course, for every death, there may be many people who are suffering as a result of that. There's also those who have been in intensive care, and we know that maybe 1 in 5 of those may well suffer with post-traumatic stress disorder. And many of you will have also seen that there is a whole range of symptoms which follow COVID for some people, particularly those who are badly affected, and those are likely to have a neuropsychiatric basis in some senses as well. So there's going to be mental health problems as a direct result of COVID infections. healthcare workers, other key workers also at risk. And of course, the group that are particularly important, and Emma's mentioned this already, are people who are vulnerable to suffer with mental health problems or who have them beforehand. And many people in this group are going to find it difficult either to have been in lockdown or indeed as lockdown begins to get released. Next slide, please. So what is it that should be done? Well, from a general population point of view, the financial safety of the population is probably the most important mental health intervention that can be done. And certainly for all other organisations, there should be a very important emphasis on trauma-informed practice and on making sure mental health in the workplace is well supported. And I'll mention the evidence-based ways of doing that in just a minute. I think what is important with local lockdowns and second waves and all that kind of terminology is just at the bottom here. Again, this comes from the Centre for Mental Health report of May this year. Is the predictions are if there are lots of local lockdowns and lots of waves, then actually the mental health risks are going to go up disproportionately. So we wait and watch what will happen, but it's not just a matter of it happening the same each time. Next slide, please. So in terms of staff who are going to work in challenging environments, and this was obviously when the pandemic started, but also people now going back to a workplace that may be far more challenging than it was before, there should be some sort of check before you go into that role. And what we advocate strongly is about a self-check, asking yourself the question, is this the right thing for me? Am I going back for the right reasons? Now, am I potentially going to bring infection home to vulnerable people in my household? This is not screening, this is checking, but really we should ask ourselves and ask our staff to really consider whether coming back is the right thing for them. If you are coming back into a difficult environment, the risks should not be sugar-coated. There should be a frank preparatory briefing. So when the pandemic started, what we were very much advocating for healthcare workers was not to tell them that, oh, come and work in intensive care, it'll all be great and you'll save lives. It should be, this is hot, this is sweaty, you'll do your best and people will die. It sounds a bit frank, but actually you can begin to get your head around the risks if you know what the risks are. So people should absolutely be well prepared for them. There is this nice concept of what's often called psychological PPE, which is just a use of terminology. And what that means is before you begin to get yourself in difficult situations, you should work out a plan as to what you will do if you become distressed. We know that when we become distressed, actually our ability to problem solve well goes out the window. So the best time to design a wellness recovery plan is at a point that you're not distressed. So that would mean, who do I normally speak to? What do I normally do? What music do I listen to? What films do I listen to? Maybe what food I like eating. List them things that keep you well before you need them. And then when you're feeling distressed, you can return to that plan and do one of the things on that plan. And probably one of the most important things to protect your mental health is to have good preparatory training for the tasks that you're going to do. I've done some work recently with a big industrial company, and they're sending people back into factories when, of course, it's a challenging environment who haven't been at work. Well, the best way to get them to feel psychologically safe is to train them properly to use the new equipment that they're going to use, rather than just throw them into a new environment. Next slide, please. So one of the things you won't have seen on there is the use of psychological health screening. And many people like this concept, which is that perhaps you could give people a questionnaire or you could get them to see a psychiatrist like me, and we would try and work out whether someone's psychologically vulnerable. And many organizations have tried to use this sort of approach to detect who's more vulnerable than others. And you can see why it's very seductive, because if you could really detect who was at higher risk, you could then exclude them from the work that would cause them problems. That saves their health, and it would also protect your organization. Now, we know what's called the grandmother test works well. And the grandmother test refers to the fact is, if you've got someone about to go back into a workplace, they didn't do well there before, they don't get on with their team, they've got a sick partner, they've got sick kids, and they're only doing it for their money, your grandmother could tell you that person's going to have problems. You don't need a posh psychological test. The problem is your grandmother would also tell you if you go out in the winter without a coat on, you'll catch a cold, which, as you probably know, is not true. So working out when granny's right or wrong can be a bit challenging. Next slide, please. Not sure if you recognize this chap. This is General Marshall, who was Chief of Staff of the US Army in the Second World War. And the reason I put his picture up isn't just that I'm rather impressed, because he was an impressive individual. is that without meaning to, he did a fantastic study on psychological health screening. So in 1939, if you wanted to join the US Army, you had to come and see a psychologist or a psychiatrist who determined whether you had true grit or you were made of the right stuff, or whatever cheesy phrase you want to use. In 1943, they ran out of people, and it was General Marshall who overturned this policy of screening people. And all those people who had been deemed to be lacking in grit were made to come in and join the military. And in fact, what they found is that 80% of them, 80%, went on and had a perfectly good war. So the screening was wrong 4 times in 5. We've repeated that sort of study in a much more scientific way. In terms of the Iraq War in 2003, we used new tests and good thresholds, and we found we were wrong 80% of the time. So it's a nice concept to screen people, but really there is no evidence it works. Next slide, please. And this is a very nice demonstration of that, published in Occupational Medicine. So I'm sure Nick will be delighted at mentioning this very recently. And this was a study done in Australia where they looked at people joining the Australian police, and they have to fill out lots of questionnaires and lots of screening. They followed them up for 7 years, and they found that the screening predicted absolutely nothing. So the idea of psychological health screening before people do the task is very seductive, but it doesn't work. Next slide, please. When people are doing challenging work, what can you do to keep them psychologically safe? So one of the things you can do is to buddy people up. Really good evidence that in a workplace, people get a lot of support from each other. And what you can do on a shift is you say, as well as you doing your task, you two, I want you two to keep an eye on each other. Your task today is to make sure that you're both doing okay. Next thing is to have supervisors who are able to have psychologically savvy chats. Really strong evidence that actually someone's immediate supervisor has a dramatic impact upon their mental health. And most important thing is that people feel able to have conversations about mental health. Good study again done in Australia, randomized controlled trial, where they trained up some fire station managers how to have a psychologically savvy chat, and the others they didn't. And they found that actually it saved about 90% of sickness absence over the next 6 months. It was really, really effective, with the most important outcome of the training being that managers felt confident to have conversations about mental health. At the end of a shift, before people go home, as well as reviewing what happened, you should also give people an opportunity to say how they're doing, one thing to look forward to. And another thing we know is really important is peer support, and I'll mention that in a little bit more in a moment. Next slide, please. One of the concepts that we know make a big difference in terms of managing people who are having stressful times is the use of these principles called the PIES principles. Now, these were developed in the First World War. They've been used many, many times in the past, and they describe what sorts of things an organization can do to try and help people who are having a really tough time at the moment. The Israeli military did a 20-year follow-up study of the use of the PIES principles after the First Lebanon War, and they found that the more the PIES principles put in place at the time that someone was distressed, the better the outcome was 20 years later on, and that's the paper there. P stands for proximity, and that basically means if you've got someone who's having a tough time, rather than say, go home, what you should do is support them in the workplace. Increase their support, temporarily reduce their stress, but keep them around their colleagues who can support them well. Immediacy says that if someone's having a tough time, don't let them go downhill. Try and nip it in the bud. Have that psychologically savvy conversation early on, find out what you can do. A good example of this is healthcare workers. So in the middle of a crisis, it's gone on, we had lots of people who were not intensive care specialists working in intensive care wards. They were very much out of their depth with minimal training. So if they're feeling distressed because actually they don't know how to use the ventilator they're meant to be monitoring, they don't need a mental health intervention. They need more training on how to use the ventilator, more support. That's the best mental health intervention they can get. Expectancy is the idea that if you're having a reaction to a difficult set of circumstances, in many occasions, it may be a perfectly normal reaction. It may not need a mental health intervention. But the other side of expectancy is that if people do keep having difficulties, then the expectation should be we're going to help them get appropriate care. And simplicity is simple things make a big difference. Getting people to have a good night's sleep, a chance to speak to colleagues can make a really, really big difference. And in fact, done well, we think that support during a crisis actually won't just prevent mental ill health, it'll probably lead to something called post-traumatic growth, which is this idea that when people go through really tough times, actually most of us actually grow psychologically as a result of that. Next slide, please. In terms of those supervisors I've mentioned being really important, this is data from Afghanistan. We looked at about 1,500 troops. You can see here that just less than 3% of them probably have PTSD, you can see on the graph. But we looked at people who felt their immediate supervisor was good versus people who felt their immediate supervisor was poor. You can see what I mean by leadership over there. And we found there's a 10-fold difference. So going back to those psychologically savvy supervisors, really, really important evidence there showing that actually your immediate line manager, their attitudes and their approach towards your mental health is vitally important. Next slide, please. In terms of peer support, well, I mentioned that actually peers are really important in the workplace. This is a study of about 1,200 British peacekeepers who came back from Afghanistan. You can see here, 97% said that they spoke to people like them about their experiences. Next slide, please, let's click. Only 8% spoke to medical or welfare service. So actually, it's really important you have a health or welfare setup, but most people speak to their colleagues. Next slide, please. Which basically leads you on to peer support. This is a Delphi study done in 2012, and this is the idea of what peer support should do. Provide a chance to listen, some very basic interventions. This is not psychotherapy, this is helping people practically. Identify people who might need help and get them to professional help. Next slide, please. And one of the ways that we have done this is through the use of a program called TRIM, which is Trauma Risk Management. This is a peer support program. It's not the only peer support program. There's psychological first aid, there's mental health first aid, no doubt there's lots of others as well. But what we know is that actually this sort of TRIM peer support process makes a big difference. And we've published 13 academic papers now on the use of TRIM. This is not penicillin for trauma, but it's a credible, supportive way of helping protect people's mental health in the workplace. Next slide, please. This is the TRIM checklist. So when a TRIM buddy who's had 2 days training sits down and talks to you, they're looking for any of these risk factors. The more the risk factors present, the more likely it is that someone will need some support. If those risk factors stay present for a month or more, then they need to get that person towards a professional to get a proper assessment. Next slide, please. And they're certainly not counsellors. They certainly don't go around giving people a hug. That's not their job. It's very much about a practical way of listening to people. Next slide, please. And one of the things we know doesn't work is this idea of flying counsellors into a workplace. Next slide, please. The evidence is very strong that psychological debriefing is not recommended by the National Institute for Health and Care Excellence. In the immediate aftermath of a trauma, you don't need mental health professionals. You need good support, good colleagues, good leadership, and you don't need mental health professionals to come in because actually they can make things worse. So which is why NICE say specifically don't use them. Next slide, please. And then coming on to recovery, you know, getting into people being at work. What people need is a good thank you for the work that they've done during COVID. Thank yous actually do make a difference to people's mental health. If you've been working really hard, your return to work should be graded, done over a period of a few days or a few weeks. Really important, again, that supervisors get back to discussing with individuals what their needs are, what they've been doing during COVID. Have they been exposed to secondary stressors like difficulties at home or poverty or problems with their children? And if they have, what can you do as an employer to make things better? When people have been exposed to morally injurious events, reflection, meaning making, sit down to talk about what went right and what didn't go right, that's a really important activity. And we think that that can prevent moral injury if it's done properly. NICE are very clear that people should be actively monitored. That means people should have a check on them done over a period of weeks and months, because most people with mental health problems don't simply put their hands up. And where people do need care, they should get access to evidence-based care in a timely fashion, which I know is difficult because mental health care sometimes is in short supply, but it's really important we get people to the right care before they lose their self-esteem, they lose their job, and they lose their relationships. Next slide, please. I won't go into detail because of time, but there are lots of ways that you can deliver mental health care, which doesn't involve seeing someone every week for 4 or 5 months. And I would strongly advocate that you get people to a professional early on if they do need mental health care, because that will make a big difference. Next slide, please. So overall, the principles of what evidence tell us is don't over-medicalize things, adopt a nip-it-in-the-bud approach, build team support as a priority. Really important you have psychologically savvy supervisors. Where you need mental health interventions, use those PIES principles because they make a difference early on. Thank people, get them back to work in a phased fashion, give them a time for reflection, actively monitor them, and then where they need it, give them evidence-based care. Next slide, which I think is the last one. That's great. That's me. Thank you very much.
Thanks very much, Neil. I mean, I'm using the same techniques you're using, and sometimes it's weird running an organisation where you members, staff know that you're playing the same game that you're told to in terms of asking how you are and thanking them, and it all feels a bit sort of postmodern and cynical. But you've got some fantastic slides there. I know the presentations are going to be shared afterwards, and for participants there will be questions after our last presenter, which is Dr. Roxane Gervais from the British Psychological Society, also an occupational psychologist, and she's going to talk about practice and how to empower people to communicate concerns and working with people to lower their anxiety. And Roxane's been a brilliant support of the SOM and our multidisciplinary working over the years, and I'd like to thank her for that. Really an excellent contribution. Over to you, Roxane. Thank you.
Oh, thank you, Nick. Can I get the next slide, please? Because Nick introduced me, so I'll just go straight into the presentation. Today we'll be covering overview of mental health, encouraging workers to communicate challenges around current work issues, and also advising workers on lowering anxiety around returning to work and being at work. Can I get the next slide, please? Yes, so what do we mean by mental health? So Mansell covered it a bit previously, and it's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses. It's very individually focused. And we're going to be covering it today in terms of the individual and what you can do to help yourself. It's also fundamental to who we are and how we perform, how we work, how we live, how we interact. And we need to make sure that we can maintain our well-being as much as possible. Can I get the next slide, please? Thank you. Now, what can affect our mental health to make sure that we have proper mental health? We know that over the last few months that a lot of the factors that we're seeing on the screen at present can adversely affect our mental health. We've had rapid social change, we've had social exclusion, and we've had persistent socioeconomic pressure. And as both Professor Mansell said and Neil said, we and also Emma as well, we don't want to socially exclude. I mean, the phrase social distancing, I think, was a bit of a incorrect term, because we want to make sure people make sure that they keep those social connections. So we want to make sure that we have the social connections, even though we're physically distancing. And also, because we're speaking about the work context today, one of the main things we're focusing on is stressful work conditions, which will affect our mental health. As Emma also mentioned, people have been drinking more, eating a bit too much. So again, you can have the unhealthy lifestyle, also the physical ill health resulting because we've been in lockdown. But we have to focus on what we should be doing towards maintaining our mental well-being. Can I get the next slide, please? So in terms of when we say about work-relevant mental ill health, we tend to think more in terms of anxiety, depression, and stress, and it could include fatigue a lot of the time. But it usually doesn't cover those mental ill health conditions, those mental disorders that people can enter the workplace with or can develop once in the workplace that may or may not be relevant to what is happening with respect to work conditions. So if we go to the next slide, please. Yes, so in terms of work-relevant mental ill health, we're not talking about depression, bipolar disorder, anxiety disorders, because these are all conditions that people will develop due to different factors that are not usually work-related. So we don't have to focus on these disorders because the organizations would have to help us manage those. But we also have to think about what we need to do as individuals. Can we go back one slide, please? Yes, so work-related. Can we go forward one slide, please? Thank you. So work-related stress is a state caused by negative reaction to stresses. That is one definition. And within the United Kingdom, I know we've got a global audience here. The Health and Safety Executive, which is a regulator for focusing on regulating the health and safety of the workforce, we have to think about what they need to focus on when they think about work-related stress, because they usually start from if an organization is causing workers to become stressed, which can then lead to anxiety and depression. So we have to worry about what the health and safety executive is focusing on in terms of how we're managing our mental health. Can I get the next slide, please? Thank you. So what are the main factors that contribute to these three conditions? A lot of research over the last 50 to 60 years have shown that having too much to do, having too much responsibility, not getting the managerial support that we need within the workplace does ensure that we actually do contract these conditions. And as both Emma and Nick has mentioned, you know, we need support within the work environment. So what can we do to make sure that we get these factors occurring more within the work environment? Can I get the next slide, please? Yes, so we need to think about how do we communicate our concerns. And can I get the next slide, please? Now, as this slide shows, communication is at the heart of what happens within any organization. We need to get good communication going. It can affect our work-life balance or health and safety as we grow as employees, as we recognize and as we become involved. And all of these conditions, once they function effectively and efficiently within a work environment, would lead to employee well-being, would also lead to organizational functioning. So again, as we say, communication is essential. And as we know, during COVID-19 and during the lockdown, we relied quite a bit on the daily briefings that the government was giving us because we needed to know what was going on, what was happening. You know, we needed to know whether or not the frontline workers were getting the resources they need, what was happening, how many deaths were occurring. So we needed that all that information to make sure that we actually understood what was happening, when the lockdown would be eased, when it would not be eased, what were the necessary conditions that needed to be met. So during the lockdown, we knew that the importance of communication, this has to continue once we step back into the workplace. Can I get the next slide, please? So why do we need to communicate our concerns? We need to raise those issues that are causing us distress. And once we do that, that allows us a degree of control. It increases our autonomy because it makes us think that, yes, we are taking action, we are doing something to move this forward. And because we are the ones who are suffering from whatever distress we're suffering from, it allows us to say, you know, if I propose this action, this would actually help me to become more effective in what I'm doing, helps to ease some of my fears, some of my uncertainty. And by being assertive as well, getting your autonomy, it allows us to look at, you know, raising our morale and also the morale of other staff members. It also encourages a culture of openness and transparency because, you know, workers then have the ability to say, this is what is not working for me. How can I get it fixed? And as Neil mentioned as well, you know, we have to think about the psychological safety of the workforce. Now, psychological safety means that you're working within an environment that actually allows you to raise whatever concerns you have. If there's an issue that's happening, if there's something that you don't agree with within the work environment, you can say, I have a problem with this. This is causing me concern. This is causing me to have, you know, mental ill health. So once you sort of raise those, and some of the places it can be a bit more challenging to raise various concerns, but you know, we have to keep doing it because while the health and safety executive within the UK is a regulator of health and safety and organizations do have a duty of care to you, you also have a duty of care to yourself as well. So you have to keep thinking, what do I need to do to keep myself mentally healthy? And also once workers become involved, that also supports a safe and healthy work environment. So by speaking up, becoming involved, raising an issue, you're actually helping to actually address some of the ill health concerns that may be happening within the organization. Can I get a next slide, please? Thank you. Now, this is one way to show you that communication covers a lot of different areas. Now, it can be one way, it can be two ways. So we can either be providing information to someone, as would happen during the government daily briefings, that is information that is being provided to us. We can use it to persuade someone to do something, or you can have a dialogue where you think about, okay, what do we need to do about this? But once you're thinking about getting an action, then we want to look at the consensus building aspect of the communication grid. We want to give information. We also want to receive information. We want to say that, okay, this is an issue that I have raised. How are we going to address it? What's the best way to address it? Can I get the next slide, please? So we want to make sure that the communication is effective. So when we say that I am uncertain about coming back to work, what are the procedures that you have in place to protect me from COVID-19? And once you say that to your employee or line manager, The information you want to get back is that the person has heard what you said. You need clarity and that they actually understand what you're saying, and also they can say that, well, this is the solution that we have at present, or this is the solution that we're thinking of introducing. So it's not just about giving information, it's making sure that the information you get back, the feedback that you get from that individual is saying that, yes, I hear you, and this is what we're going to do about it. Can I get the next slide, please? But of course, as with any situation, organizations are different. So there needs to be a lot of trust involved in the process. And if you trust what's happening within the organization, if you trust the person you're speaking to, that supports you in actually making sure that the communication is effective and efficient. You also need to that you have courtesy and there's openness to communication, not afraid to, and again, this goes back to the psychologically safe work environment, work organization. Is there openness and transparency? Is, can someone say, yes, I have an issue with this? As Emma was mentioning, you've got the financial well-being that's not present for a lot of individuals right now. You've got the social well-being, you've got the mental well-being. So, is there openness where I can say, this is an issue for me, what can we do about it? Can I get the next slide, please? And as we know, communication is not just about words and what you're saying. It's the tone of the voice and the non-verbal behavior. And as most of us are now living in a virtual environment, even though some of us have started to return to work, a lot of the interaction is still virtual. So it's a bit difficult actually to say, and we all know it's pretty artificial. So we can say, okay, what's happening here? You can say the words, but can I get the next slide, please? But it's also about how you see the person, what's going on, the tone of their voice. And again, because we're virtual, some of the non-verbal communication body language would be missing a lot of the time. So you might not be able to pick on all those nuances of what is happening and whether or not someone is actually hearing what we're saying and interfacing with us. We can still try to keep the eye contact, look at the person, look at the facial expressions. But it's a bit more challenging virtually, but we still have to try as much as possible to communicate what our concerns are and say, okay, how can you help me move forward with this area of my life that's causing me a bit of stress? Can I get the next slide, please? Okay, we're going to focus for the next few minutes. I think I've got enough time about anxiety, returning to work and being at work. Can I get the next slide, please? Now, I found this quote, which I thought was quite interesting. It focuses on worrying. And if we worry too much and add to our anxiety levels, is it actually helping us to move forward with all the challenges that we're facing? Usually not. So can I get the next slide, please? And Lubbock was talking about this in the context of work as well. He was acknowledging that work is good for us, and it helps us actually keep physically healthy and mentally healthy as well. Exercise of the muscles keep the body in health, and exercise of the brain brings peace of mind. So if we focus so much on the worrying aspect of it and worrying what could probably happen, it is actually stopping us from actually moving forward and communicating our concerns and figuring out the best way to actually address these various challenges we have within the environment. Can I get the next slide, please? Again, now these are some standards that the Health and Safety Executive developed, but they're also built on other research. Other researchers have found that shows that these are the main areas that actually impact on whether or not we become mentally ill within the workplace, starting with work-related stress. So if you've got too many demands, if you don't have the control that you need within the environment, if you have poor support, and both Emma and Neil mentioned this as well, if you have poor relationships, if you don't understand your role. And within the COVID-19 context, we've had quite a lot of people who've had to change roles. Their roles have become unclear. They've gone into a totally different job that they may, and as Neil mentioned as well, they may or may not have had the competencies to do the work, but they have been doing it. And also the change. As we know, the entire system has changed across the world. Every organization has to make some sort of change to make sure that they are able to function. Those have shut down, they've not been able to move forward. So change has been constant and change and continuous as well over the last few months. Can I get the next slide, please? So in terms of how can we address these specific work stresses actually have been shown to actually increase our anxiety levels. If you've got too many demands, what can you do as an individual? You can assess what you can do and what you can't. What is feasible? And then you can discuss this with your team or with your line manager, saying, this is what I can do. This is what I have the capacity to do at present, and I'll catch up with whatever else needs to do in time. If you got low control, what can you control? And you need to focus on those meaningful aspects of your job that's actually, actually enhancing your well-being. Poor relationships, you can focus on those that don't work, but keep those professional. And, limit connections and communication if you need to, but also look at your networks outside of the work environment that's actually going to help you perform better and manage your mental health a lot better. Can I get the next slide, please? Again, if you've got poor support, you can request support. You can make sure that you speak up, that you say, this is what I need. Your undefined role. Again, a lot of organizations are going to have to think now exactly, because they've had so many changes, do we still need these specific roles? Do we need new roles? Do we need to adjust roles? So again, this would probably be another discussion between you, line manager, and whoever, and part of your team as well, to say, okay, what is happening here? What should we be doing differently? Poor change management. Some organizations have got it right over the last few months, some have not got it as well as they could have done. So again, how can you contribute to making sure that the change management goes smoothly? Again, a lot of people have the uncertainty, the fear, they don't know what's happening. Again, can you say, I need more information about this, I need more information about that? How can you be contributing to that, to help this move forward? Can I get the next slide, please? Now again, because of all the technology and the fourth revolution has happened, a lot of what we do now is linked to some form of IT, computers, mobile phones, tablets, games, so we work, we home, we play, we sleep. All of the interfaces, all of the platforms are more or less the same. And there has been an argument that says that, we should look at integrating life and work, but that's not really feasible, because we do need to step away from the virtual environment at some point in time. We need to go outside, get some air. If you want to play, it doesn't have to be on a laptop, on a gaming console. We can go out, we can take a walk, we can, once they open back the gyms and so on, we can interface with people, but we can't just spend the entire work life, integration in one context. It has to be different, because we do need difference in our lives. Can I get the next slide, please? So we need to invest in our self-care. We need to get adequate and quality sleep, be physically active, look at our health. We want to make sure that we can relax. We do not want to ruminate, because once we start to ruminate, once we start to think about what's happening, what went wrong, what could we be doing differently, why did that not work, why am I so afraid of going back to work, what can I be doing differently, it actually helps to perpetuate the anxiety that we're feeling. So we need to make sure that we can relax. We don't keep going over into worrying, being anxious, looking forward to what might happen or what might not happen. So we need to make sure we can relax both the mind and the body. We need to socialize. And we need to raise awareness of and practice self-compassion. Accept yourself, love yourself, look after yourself, because if you don't do it, who else will? Can I get the next slide, please? So we do need sleep, and we don't only need quality sleep, we need quantity sleep as well. So even though we sleep for 8 hours, which is a quantity, maybe 6 of those hours might not be as good for you as you think, so you're not getting the quality sleep. And also we need to make sure that when we sleep, it's a deep, restful sleep. And lots of people think that we can always catch up on the sleep on the weekend if they work 5 days a week and they have the weekend off. But that usually doesn't work, because we don't ever replace that sleep as well. And also we can look at naps, because naps are good for us. So take a nap during the day, because that's been proven to work. But if we're losing sleep, we never get that sleep back. And that actually impacts on who we are, what we do, and our metabolism. Can I get the next slide, please? And of course, this shows all the evidence that shows that poor sleep is bad for business. It allows to more work injuries, allows us to make poor decisions. It can impact on harming someone if we work in the healthcare professions, because we're not thinking clearly. So we need to make sure that sleep is essential for who we are and what we do. Can I get the next slide, please? Next slide, please. Thank you. And of course, more information that shows that the relationships between sleep and fatigue, and making sure that we don't, because lack of sleep, again, is related to fatigue, depression, all these things interconnect. So we think that, okay, if we get 6 hours, we can always, manage on that. Well, we are managing for a short period of time, and it will eventually catch up with us. So we have to think, okay, am I getting enough sleep? And that will also help us to stop all the worrying that's going on. Can I get the next slide, please? Thank you. We also need to focus on moving, because exercise, again, improves our physical and psychological being. We know this as well. Exercise improves on depression and helps us to be less depressed if we're moving the body as well. And we have to get better at balancing work life and home life. We have to think more clearly, address those issues more positively. So if it's just going for a walk, doing some yoga, and again, we know that we've all been using YouTube because the gyms aren't open as yet, and to catch up on the exercise and the yoga classes. So find some way to actually move the body. You know, the body is not meant to be sitting behind a computer all the time, because that causes a lot more strain on the body itself. So we need to move a lot more. Can I get the next slide, please? We have to become aware of ruminating. Are we making ourselves more anxious than we are? And we do have concerns. We are a bit anxious, but going back to work, knowing that the coronavirus is a deadly virus, it can cause you to die, it can cause you to have breathing problems, other health problems. But there's only so much we can do, and we have to make sure that we, you know, not think about ruminating too much and making ourselves more anxious. We need to step back sometimes. We have to think about poor sleep patterns. How can we improve this? Again, take naps, make sure you get quality and quantity in sleep. What's our mood like? Can we improve on our mood? We, you know, find something to take us away from the constant chatter that we're hearing, especially the internet. The internet is fine, it's very productive, but it can be quite distressful, because we get information, we think, oh yes, I've got all these symptoms, I'll go on Google. Don't do that, please. Go to a doctor and figure out what's wrong with you. Don't use Dr. Google to, you know, diagnose what's wrong with you. If you do have concern, get the appropriate medical condition. Look at our use of IT, smartphones, tablets, teleworking. We need to, you know, think, okay, it's know when to step back from work and also from technology. Put the phone down, have a conversation. But right now we need to have the phone to have the conversation, but try not to allow it, you know, to take over your life as such. Can I get the next slide, please? So we need to think about, find an activity that you like and just do it, whether it's reading a book, doing some yoga, going for a walk, taking the dog for a walk, playing with, you know, if you've got different animals, you know, just interacting with them, have fun, enjoy work and enjoy life. Next slide, please, which I think is the last slide. Thank you.
Thanks very much, Roxanne. I'm going to hand over to Anne Harris now. But that's a brilliant presentation. And Anne, hopefully, has got some questions from the Q&A, but do put your questions in, and Anne will then discuss with presenters about that. So we've got about 25 minutes before we wrap up. So I'll hand over to you, Anne.
Okay, thank you very much. And thank you very much, panel, for some really interesting and thought-provoking sessions. So I'm going to start building on what you were talking about, Roxanne, and you mentioned about change management. Organisations have really had to change how they deliver work over the last few months. Any hints or tips for managers as to how change management can best be facilitated, please?
Yeah, I think it's important, again, have the conversation, have the dialogue, look at consensus building. Because, I mean, workers usually know what's not working, and they can tell you what's not working, and they can be very vocal about it. So I think it's about, you know, giving people the information when they need it and as soon as they need it. Don't think that they want to hold on to this information, because that doesn't help as well. So be open, be transparent, provide different ways actually for staff to actually be comfortable with the decisions that you're making as well. They might not like it, but they can be comfortable with it, and making sure that they have that comfort level that says, you know, okay, I can work with this, it's not really going to help me, but make sure that staff are comfortable with what you're doing as well, to facilitate that, because we know that change is inevitable, and because people have changed. Over the last 4 months, people have gone through a lot of different changes. They have adapted quite well. They've been productive, they've looked after kids, they've done homeschooling. So again, people are not afraid of change, but it's just a matter of making sure that you, and as Neil said, you know, thank them for doing the change as well. Make sure that they are comfortable with it.
Mm-hmm. Thank you. A question to Neil, as I can see this come up on the chat box from Nicola. How do we support and equip supervisors most effectively to have psychologically savvy discussions?
So really good question. So I guess there's two ways of doing it. One is, of course, people can sometimes do these sort of things because of their life experience, in which case you should encourage them to do so. The other is, of course, to provide them with relevant training. The most important bit of that training is about giving them a simple template to have such conversations. I'll give you an example in just a second. And also that they get to practice. So the most important bit of any skills-based training isn't just giving someone a PowerPoint set of slides, is they have to get to practice those skills, you know, ideally in the classroom, and no doubt get them wrong and then have some feedback so they can develop them. And once they've got them in place, then they have to start using them pretty quickly, because you get skill fade very quickly with psychological skills if you don't use them. So one template that you can use is using a model called REACT, which R stands for how do you recognize that someone has a problem, how do you engage them, how do you actively listen, how do you check risk, and that's the risk that they might harm themselves or others, but also the risk that they might not do their job well or might not come back to work. And then T stands for talk about a specific plan. And this is a simple way of getting people to open up. What we often know is when someone says, how are you doing? That some of the answer is, I'm okay, or I'm fine. And then that's the end of the conversation. And of course, that doesn't lead people really any further forward. So there's some very simple approaches that you can get managers to be able to use, such as saying, well, I'm glad you're doing okay. I have to say, I'm finding it pretty tough. You know, and that begins to start moving into having a conversation rather than just a simple check. So that training can be anywhere from an hour to half a day, depending on what sort of managers that you've got and what's available. But it has to be a bit about giving someone a simple set of model with some questions, and also about getting them to practice using them in the classroom and then put them into practice shortly afterwards.
Yeah, that's a very good point. I think one of the problems for managers is that some managers have been promoted through the ranks to a particular position, but they've not necessarily had the training that supports them in these sorts of issues. So I think there's a real need for managers to have an understanding of the effect of work on mental health, the effect of COVID on mental health, and to think about how they can best support their employees as they return to work following lockdown.
Can I just come back on that, and I completely agree. And there's also some managers with the best will in the world are just not necessarily the best people, and that's okay as well, you know, because management's about lots of things. I think one of the advantages of having a peer support process in your workplace is that if a manager just isn't great at having those conversations, then their management responsibility is to make sure that one of the peer supporters does it. So it's not that no one does it, it's that somebody else does it, even if they can't do it themselves.
Yes, absolutely. And the individual may find it difficult to talk to their manager if they don't have a good relationship with them, and you can't like everybody in life, and therefore peer may be a better person to go to. I've got a question here from Monica, who says that she works in insurance. Many income protection providers have made available health apps, including remote access to GP consultations, to support their customers who are struggling with work or are already absent from work. What are our thoughts on the effectiveness of health apps to improve well-being and help people return to work? I'm going to back that one over to Roxanne, please.
Can you unmute myself?
Thank you.
Yeah, I mean, apps are fine. Apps are helpful, but they should not be the only thing that you depend on. Again, you need to get actually specific advice about what's wrong with you. So apps are fine over the short term, but you do need the expert support and actually understanding how best to move forward. And again, any tool, technique that actually helps you to move forward with your mental health is worth doing. But you have to realize that it's not the only thing you should be doing. If you want to, like Neil said, if you want to do mental health first aid, if you want to do the trim, anything that actually helps you is fine. But you do need specific support at times, and you should look to get that from your GP or whomever is the expert in the room as well. So you can't just rely on health apps to actually help you to move forward with your mental health issues.
Thank you. And to Emma, what resources do Mind have available? And don't forget to unmute your microphone.
No, thanks, Anne. So we've developed a host of resources, but building on what Neil was saying, if someone was living with a mental health condition, there's a person-centered tool that people can use, a wellness recovery action plan that they would develop in partnership with their health professional, which would capture how they stay well, what are the signs they might be struggling again with their mental health, what's helpful for the person to do to manage that, and what's helpful for their health professional to do. And we've adapted it with permission for the workplace, and we've called it a wellness action plan, and it can be used as both a proactive tool that anyone can use to manage their mental health. It can be a reactive tool if someone has struggled or taken time off, and so on. And again, it's about capturing what are the steps I need to take to keep myself well, what are the signs I might be struggling that a manager can look out for, what are some of the workplace triggers that are unique to me that cause me to struggle, and then what steps I can take and what steps my manager can take. And it's just a very helpful framework for having a good conversation between a manager and the people that they support. And it really gets down to, what does this look like for me? Because we're all individual. What keeps us well will be individual. What will cause us to struggle will be individual. And what's helpful for a manager to do will be different. And it's hard as a manager to know that. So having those conversations, and it should always be a living document. It needs to evolve and be reviewed, but I can share a link to that in the chat window. So that's something we've developed in terms of how you can support people at an individual level. And then we've also produced guidance for managers who might be overseeing teams remotely, because that may not be something they've signed up for previously, so just trying to share and so on. And then we've got e-learning and training for line managers and supervisors. And it's similar to what Neil was saying. I think it's about the ways of working and approaches that a manager can adopt to keep people well, but then how comfortable and confident they are having routine conversations about well-being. And when you ask someone how are they and they say not great, you know where to go with that and you feel comfortable with that. So it is looking at how you equip your managers across all of that.
That's a good point. The other thing, though, is somebody might say, oh, I'm fine, but when you actually look behind that screen, they're not fine. So it's also recognising when perhaps what you observe isn't necessarily what the worker is telling you.
Exactly.
Now I'm going to go over to Mansell. Mansell, don't forget to unlock your microphone. How would you sell promoting mental health to employers so that you have happiness embedded within the organisation?
Yeah, well, I think we've attempted that and succeeded, particularly with some large companies and organisations like the Royal Mail, etc. And that is actually showing first of all, giving some evidence with regard to companies that you have worked with, or that there's evidence on, which shows that productivity improves remarkably when you address these particular issues. Secondly, that we discovered that the return to work interview, which is undertaken by managers, particularly in large organizations, is one of the big negatives if it's not done very well. And so what we've advocated with the larger companies, and now small to medium, is to ensure that line managers are trained. This has been addressed already, but more importantly, that in the medium to larger companies, workers, as I call them, and line managers, as they are, working together in groups, in focus groups. This may be old ways of doing things, but it works. We did a comparison looking at an app in regard to promoting health promotion app and return to work app against a group of selected managers, not selected because of any particular problems, and looked and compared how the outcomes were in regard to the face-to-face compared to the app. And the face-to-face, even if it wasn't done as well as one would expect, because we agreed for people to be monitored and assessed during these sessions, they were remarkably more potent at helping people, one, to return to work, one, to avoid presenteeism, and three, to engage more closely with their manager. By presenting that information together with information from others which we could not do about the relationship between productivity and absence from work and people at work's satisfaction with their job, that persuaded large companies and medium companies to actually take this more seriously. So it's a matter of education, of bringing people together, of giving solid examples that when you ultimately get the accolade and you're asked to present to the board of a large company, you go along, you spend about 10 minutes and you hit them with those particular facts which are evidence-based. And that's the way we think we got forward more with companies in adapting the way they work and in improving their productivity by improving the satisfaction measured in their workforce best.
Thank you. That's such an important point. Selling health issues to employers is often best done by explaining to them what the benefit is to the organisation.
Exactly.
Of which the employees part. Now, I've got time just, I think, for 2 questions. I'm going to put my own question in first, and then I've got a question from Haneen. So I'll do my question. Could you tell us a little bit more about the TRIM programme, Neil?
Yeah, so TRIM is a peer support model. It started in the British military in the late 1990s. It became military policy in about 2007. It's now used by a wide range of organisations who predictably place people in challenging situations, such as the emergency services, diplomats, BBC and other media organisations, train companies and the like. It's not the only way of delivering peer support, I would say. We've done 13 academic papers on it, including a randomised controlled trial. It's that added together shows it's credible, it's perceptible, it makes a difference in terms of mental health and help seeking and social support. It involves a 2-day training program where you take people who are volunteers who have got the right sorts of skills and you put them through a basic understanding of what trauma is, but then you get them practicing how to have conversations with colleagues who've been through a tough time. And where it's particularly useful is where you have significant incidents that occur, traumatic incidents occur in the workplace. And so that might be sort of emergency services, big terrorism incident, but it's also equally as useful for something, say, like a midwifery ward, which we train plenty of midwives, where, where, to be fair, there's trauma pretty much, very, very regularly. And that sort of type 2 trauma can be quite insidious. So the TRIM practitioner there will be around and available, whereas after the big disaster kind of, terrorism incident, you then have a structured response in how to monitor people. What it isn't is counselling. It's not mental health professionals delivering the TRIM support. It's very much fits with what NICE would call active monitoring, and it applies those PIES principles of trying to keep people at work but supported at first, and that if that doesn't seem to help them over time and they still remain distressed, then the idea is to filter them through to a professional who can provide a good assessment and care if needed.
Excellent, thank you. And this final question for you again, Neil, sorry. What's the best strategy to overcome stigma in the workplace with regard to mental health?
So basically, we did a bit of an evidence-based review of this probably about 5 or 6 years ago for the military, actually. And there's 3 main strategies that are used to reduce stigma at work. The first of them is education. So that's having people like me or someone stand up and talk about mental health and saying it's really important. That's quite useful for setting an organisational culture, but people with mental health problems don't tend to believe it. They tend to think, yeah, that all sounds nice, but I don't believe that's going to happen. What's really useful is an approach called contact, which is where you have someone who's doing pretty well in an organisation, who's had some difficulties, stand up and say, my name's Bob, I'm the finance deputy director, you will know me and see me around. What you don't know about me is actually 6 years ago, I fell apart. I was off for 6 months, I was drinking alcohol, my relationship split up, and I fell apart. But I had some really good care. I came back to work, they really helped me, and here I am now, I'm successful. That could be you too. So that's someone talking with lived experience who is respectable, who in the audience people then think, well, if they're saying that, maybe I can do it. So that's called contact. And the last is called protest, which is where something doesn't go right, because things always don't go right, where someone is discriminated against or a policy inadvertently means that people don't get treated fairly. Rather than fix it and cover it up, what you do is you say, do you know what? This happened in our organisation. It shouldn't have happened. We are really sorry. That is not who we are. So put that together with education, contact, and protest. Those 3 strategies overall are quite good at changing organisational culture over time. But even in the best organisation, it's still worth saying that many people with mental health problems don't immediately come and get support, which is why you need those psychologically savvy supervisors to be asking and peer support systems around as well.
Excellent, thank you. I think one thing that is very sad is that we are more than happy to talk about our physical illnesses, but there's a lot of stigma still about mental health. And of course, we all have mental health. We're all on a continuum. It's either good mental health or less good mental health. And the fact that people feel uncomfortable talking about their mental health is quite sad. I think we're seeing a change, and particularly when you have organisations such as Mind promoting mental health, things are all going to improve to that effect. Well, that's brought us to the end of the questions. Nick, are you going to introduce the final session with Mansell?
Well, happy to. I mean, I think the last session is for Mansell and the Bevan Commission to sum up. I'd really like to thank from the Society of Occupational Medicine, Anne Harris, obviously our fantastic president, Roxane Gervais from BPS, Neil and Emma from Mind. It's been a fantastic afternoon. Do look at the resources we've got there. I think there will be presentations sent out afterwards, and also certificates of attendance. And we really value this partnership with the Bevan Commission. And Mansell's also a great leader in terms of work and health, and we're discussing with him about other proposals we hope the government will take forward in terms of academic research in mental health. And there has been some calls from UKRI and also the Wellcome Institute for some research in this area. So there's clearly still some unanswered questions and still things we're learning about this. And certainly we want to do more in terms of mental health and return to work. Do keep the questions coming in the comments, and we'll try and answer them. But I might just hand over to Mansell to have the last word, also with Helen from the Bevan Commission. Thanks very much. Thanks, Anne.
Helen and Mansell, don't forget to unmute your microphones.
Unmute. I'm unmuted, correct? Yes?
You are.
Can you hear me?
Yeah.
Yeah. Well, I've just got a few words to say because my pen has not left the paper. I still use pens and paper because I've made so many points for my own education and memory that I've had to look at them now to try and pick out what were the most important aspects that I felt came out of this. And one thing that I really welcomed was Emma when she started by saying COVID outbreak cuts across all areas of well-being. You know, not just the ones that we readily think of, but people were affected adversely right across that whole spectrum, whichever way we define well-being. And that the perceptions which were evident in newscasts and people's interviews, but were not documented until, were documented, but I didn't realize they were being done so by Emma and her people, was the thing that I didn't come across this, but that some people felt that their conditions were not serious enough to be referred for them to go to the doctor. We didn't pick that up in a little bit of work we did, but it is readily a very important issue. And something that has resulted in the excess deaths that we're witnessing. The other thing that came across really, really solidly from all speakers really was communication, communication, and communication. And that was so important. And the other thing is, Neil, I think, measured it, when we're looking at workplace issues and changing behaviors and even change management, the importance of thanking people, of people feeling valued, of people recognizing that they're part of an organization which values them is so important. And I think that came across. Support not just from the management, but from the fellow employees and from the family, so important. And I've witnessed that in the last 6 or 8 weeks. I like the phrase psychological PPE, Neil. That's very good. I like that. It helped me a lot in understanding and getting that message. Will help me getting the message across. And moral injury was something new to me. I hadn't heard the phrase, that's my ignorance, but when you described what it meant, I can really understand where I've encountered that, and I haven't had a word or a phrase to use to express it. So I'm very grateful for that, and so should the people who've been part of the audience here today. The other thing, ending on, I thought my social transmission thing might have been a bit offbeat, but actually it wasn't, because every single speaker and the things they've presented are related to social ties, related with social connectivity, how we can actually exploit that to ensure that we do not suffer mental health problems and other problems that undoubtedly are going to continue in the next, if there is a next phase, or even if there's just spikes. The other thing is, I thought at the very beginning, when they started talking about social spacing, or whatever word was used, that was very bad, because we didn't want social spacing. We wanted to integrate. We wanted people to come together. And it should have been physical spacing rather than social, because some people misunderstood that when it was first used. The importance of sleep and the importance of isolation, so very important, and really that came across very well, I think. So that's what I picked up, and I greatly enjoyed this. I greatly enjoyed learning about the grandmother test too. I learned about that. That's good. I'll remember that one. But now I think I should hand over to Helen. We haven't colluded on this, but either I or Helen would give the thanks. I think it's best for Helen to thank everyone. But I should thank Helen for the work that she's done in realizing this particular webinar, and others that have happened in the past. So could I hand over to Helen now so she can thank everyone?
Yes, thank you everyone, and thank you for that, Mansell. I think this is really important, and the Bevan Commission is undertaking currently a piece of work looking at how we can create, if you like, how we can take account of the wider environment and create that sort of environment for good, positive, mental health. So again, you can't take, and we've heard it today, you can't take mental health and just put it in the workforce. It's that whole context within which we live, work and play. And the current piece of work we're doing is being led by one of our commissioners, Dame Sue Bailey, and we're working alongside the Mental Health Trust as well. And we've done some preliminary work around this, and we will be exploring through wider consultation with others. And it will include inevitably an important facet of how do we ensure that the workplace is a key component of that. So many thanks for that, but just watch this space. That's the work we'll be continuing. I think what's really struck me, there are two things that struck me. One is this issue around don't overcomplicate it, don't look for the complex. Actually, if we can get this supervisor support and peer support, the evidence and the kind of things that we've heard this afternoon, we need to work on that. And I just wonder myself, there are tools out there. We know the Society of Occupational Medicine has produced a number of tools in the very rapid and recent past. So let's have a look what's there. Don't reinvent the wheel. We've heard from Neil about TRIM and PIES. And I suppose part of this is how do we also learn from each other? Because none of us has got all the answers. And what we found from our recent seminars such as this is that many of the answers and many of the solutions are actually in the room with the people. We've all got some facets. And as with previous events, one of the things I will ask and challenge is how might we or you as a group use each other as a peer support group to say, actually, what did he mean by that? Or has anybody got any further information on this, whether it's today, tomorrow, or in a couple of weeks' time? And I think that will be a really important key positive thing that will come out of today. It's not just about today, it's about what happens in the future. So I'll leave that with you, and maybe Neil and Anne and I and others, we can look at how best we maintain the opportunity for you to link a network. Thank you very much, everybody. It's been an absolutely super session. Thank you.
And let's not forget Nick, who has been instrumental in putting this all together. You've done a good job. Thank you, Nick.
Bye all.
Thanks all. Bye. Great job,
Bye.
presenters. Thanks everyone.
Thank you. I hope we can do some more with you. Okay, I'm signing off now. Bye-bye. Mansell?